Hello there. Thank you for joining us on this episode of NAFDAC in Your Health. On this program, we bring you the activities of NAFDAC in carrying out our mandate of safeguarding the health of the nation. My name is Okpejemi Urimolade. Today's episode of NAFDAC in Your Health begins with the press conference where the NAFDAC DG announced the blacklisting of AVEO Pharmaceuticals Ltd, an Indian-based company producing harmful drugs and illegally exporting them to Africa, and particularly Nigeria. And on the second segment, we will be bringing highlights from the conference commemorating the 10th anniversary of Healthcare Federation of Nigeria, where the NAFDAC Director-General gave the keynote speech. NAFDAC, in an effort to curb the menace of substandard, falsified, and unregistered drug products in order to ensure that public health is protected, has put her eagle eyes to more intensive use lately. The characteristic activities of the agency that are geared towards this responsibility have been heightened. Other consulted policies and strategies have been put in place lately. Part of the outcomes of these efforts made in this regard is the recent nationwide enforcement activities that led to the massive rates of drug open markets across the major cities like Lagos, Aba, and Onitsha, where such markets exist in Nigeria. In further operationalizing the resolve to nip the menace of harmful and life-threatening drugs in the bud, NAFDAC recently announced the blacklisting of AVEO Pharmaceuticals Ltd, an Indian-based pharmaceutical company. The company is based in Mumbai and managed by Vinod Sharma. The NAFDAC DG made this announcement at a press briefing in Abuja recently.
A company named AVEO Pharmaceuticals, based in the outskirts of Mumbai, India, managed by Mr. Vinod Sharma, is involved in the production, sale, and exportation of a range of addiction pills containing a harmful mix of tapentadol, a powerful opioid, and carisoprodol, a banned muscle relaxant with addictive properties that can cause overdose or death. The mix comes as tafradol or Royal 225. The BBC World Service investigation revealed that packets of these brands branded with the AVEO logo have been on sale on the streets of Ghana, Nigeria, and Cote d'Ivoire towns and cities. AVEO Pharmaceuticals India is also implicated in the manufacture of high-dose tramadol for export to countries in West Africa, including Nigeria. The press briefing is to inform the public that NAFDAC has never registered tafrodol or Royal 225 or a strength of tramadol greater than the prescription strength of 100 milligrams or any product manufactured by AVEO Pharmaceuticals Ltd. Therefore, drawing from the NAFDAC Act Cap N1 2004 and the Counterfeit and Fake Drugs and Unwholesome Processed Foods Act Cap C34 2004, NAFDAC has decided to blacklist AVEO Pharmaceuticals Ltd. We have also put in place measures to prevent future registration of any product manufactured by this company. An undercover operative sent inside the factory posing as an African businessman looking to supply opioids to Nigeria with a hidden camera recorded his interaction with Mr. Vinod Sharma, who confess to exportation of large consignments of this combination of drugs across West Africa and their distribution for abuse as street drugs and opioids. This drug combination, when taken, the taker becomes still, the user becomes immobile. Therefore, we have to please take this out to our communities to warn our young people about drug abuse, abuse of narcotics, misuse of drugs without prescription. The combination of drugs is not licensed for use anywhere in the world. Neither is it registered, as I said, by NAFDAC. It can cause breathing difficulties and seizures, and of course death. An overdose can easily kill. Despite the risk, these opioids are popular as street drugs in many West African countries because they are so cheap and widely available.
Professor Mojisola Adeyeye enumerated the key findings on AVEO Pharmaceuticals that made the blacklisting inevitable.
AVEO Pharmaceuticals is implicated in the manufacture and illegal exportation of tramadol above 100 milligrams, particularly 250 milligrams. 250 milligrams of tramadol can fry somebody's brain, and on the long run, the person is going to die. Because it's not just the brain that is frying, it is also the essential organs, kidney, liver. Another finding is that the illegal opioid comes in different brand names such as Safradol, which I just mentioned, and Royal 225. The illegal brands carry the logo of AVEO Pharmaceuticals. The illegal opioids are street drugs causing opioid dependence in Nigeria, Ghana, and other West African countries.
The NAFDAC DG also spoke about the agency's enforcement activities that have been heightened.
We have intensified our enforcement activities against the sale of illicit and counterfeit pharmaceuticals across major distribution channels and hubs across the country. And this will continue to happen to make Nigeria an uncomfortable place to engage in such unethical and unapproved distribution of fake, substandard, falsified pharmaceutical products, including narcotics. We are also working with other regulatory authorities and security agencies to curb the entry into Nigeria through our borders and ports, and thereby prevent the distribution and circulation of these dangerous products.
The NAFDAC Director-General reiterated the agency's commitment to protecting public health, advising the public to be NAFDAC's partners in the efforts to keep the nation safe.
NAFDAC has consistently worked to ensure that public health is protected through the entrenchment of international best practices during product registration, which include dossier reviews or the application package reviews, good manufacturing practice inspections, and laboratory analysis of products intended for registration. We also have post-marketing surveillance and pharmacovigilance activities and pre-shipment inspection scheme. We call that Clean Report of Inspection and Analysis, CRIA scheme, for high-risk countries like India and China. These measures are there to support NAFDAC's efforts at prevention of import and distribution of substandard, fake, and falsified pharmaceutical products, including narcotics, into Nigeria. It is therefore advised to support NAFDAC's fight against fake, substandard and falsified pharmaceutical products, in this case narcotic product, is an opioid. They are also advised to avoid the use of unregistered products and consumption of medicines without prescription from trained medical practitioners or from the advice of a pharmacist. This is to assure the public that NAFDAC will continue to deploy various methods to ensure that only quality, safe, and efficacious medicines are available for distribution, sale, and use within Nigeria.
When the NAFDAC DG was asked how the efforts of NAFDAC can stem the tide of distribution and circulation of substandard, falsified, and harmful drugs in Nigeria, the NAFDAC DG had this to say.
We have blacklisted several companies before, and we sent the letter of blacklisting to the embassy because it is a bilateral trade. If your trade is going to hurt my country, I will let you know and read you a riot act. We are taking this further now by going through Ministry of Foreign Affairs. It's country to country. There's no country that is better than the other. We are all countries according to them. We are going to continue to form strategic partnerships. It is strategic partnership that is helping us as we speak with NSA. They gave us 1,100 security forces.
The NAFDAC DG has always emphasized the strong collaboration that exists between her agency and the Pharmacists Council of Nigeria, and this was again reiterated at the press conference. The NAFDAC Director-General highlighted the complementary roles of NAFDAC and the PCN in safeguarding public health. However, a media report by AIT, a media organization, gave a misleading report on the press conference under the headline, NAFDAC implicates Pharmacy Council of Nigeria in fake medicines. In her reaction to the misleading report, the NAFDAC DG, Professor Adeyeye, issued a press release describing the report as a gross misrepresentation of the facts conveyed during the press conference. The NAFDAC DG said nowhere did she implicate the Pharmacy Council of Nigeria of any wrongdoing. Instead, she gave a detailed legal, regulatory, and historical perspective on the roles of the two organizations in ensuring the safety of pharmaceuticals and the challenges that arose due to past regulatory inconsistencies. The NAFDAC DG has therefore called for the immediate retraction of the misleading report. In the same vein, a statement signed by the Registrar and CEO of the Pharmacists Council of Nigeria, Ibrahim Babashehu Ahmed, said at no point did the NAFDAC Director-General accuse the Council of any wrongdoing. The PCN Registrar emphasized the Council's long-standing collaboration with NAFDAC, citing their joint efforts in shutting down illegal drug markets, including the recent closure of the Sabongeri open drug markets in Kano and relocation of vendors to the coordinated wholesale centers. NAFDAC and Your Health continues after this short break.
Substandard, falsified, and counterfeit medicine is a threat to maternal and child health. NAFDAC, in its commitment to prevent maternal death and drastically reduce child morbidity, advises healthcare providers to ensure that quality, safe, and efficacious medicines registered by NAFDAC and properly stored are used. NAFDAC requires that registered medicines must have NAFDAC registration number, batch number, manufacturer's name and actual location address, manufacturing date, expiry date, and scratch and test for anti-malaria and antibiotic medicines. NAFDAC advises the general public to purchase medicines from registered pharmaceutical retail outlets as prescribed by the healthcare providers. NAFDAC, safeguarding the health of the nation.
Welcome back. You're still tuned to NAFDAC in your health. Partnership and collaboration have been the integral parts of the hallmark of the successes and achievements of NAFDAC. This is why NAFDAC does not operate in isolation. One of the partners of NAFDAC with whom the agency has been exploring great frontiers is the Healthcare Federation of Nigeria. A conference recently organized to commemorate the 10th anniversary of the Healthcare Federation of Nigeria provided another opportunity for stakeholders in the health sector to discuss the respective advancements and what the significance of their partnerships and collaborations have been to their collective development. Among the relevant stakeholders in attendance at the conference were the Minister of Health and Social Welfare, Professor Ali Pate, who was represented by the National Coordinator, Presidential Initiative for the Healthcare Value Chain, Dr. Abdul Mukhtar. The conference, which was themed Expanding Access to Quality Healthcare, Transforming Nigeria Through Innovative Partnerships and Sustainability, was held at the Lagos Oriental Hotel. In her presentation titled Transforming Healthcare Through Regulatory Innovation and Partnership, the NAFDAC Director-General, Professor Mojisola Adeyeye, who joined the conference virtually, underscored the significance of regulatory innovations and strong partnership.
I believe in starting from the beginning with a goal of having measurable metrics. In terms of transforming healthcare, from the regulatory perspective, strong leadership and governance extremely important. And what does that do? It gives awareness of local needs and operational environment. It becomes sensitized to supply chain monitoring. And of course, in terms of where we are in the world today, we cannot do without technology. So that will involve adoption of technology.
The NAFDAC DG also spoke about NAFDAC's awareness of local needs and her operational environment, policies, and the achievements recorded.
We cannot be in Nigeria and start thinking of what European needs are or what Asian needs are. We have to think of our own needs. In terms of our 5+5, and I will start from that. We were addicted as a nation on importation. I don't know whether it's colonial mentality that we thought that anything that we make in Nigeria cannot be good. We stopped that. That if we be importing medicines or whatever for forever in Nigeria, to Nigeria rather, it's high time we stopped and start thinking. So we had our 5+5, that you'll be having that 5 years grace every year, every 5 years for renewal. The next 5 years will be the last 5 years. That was March of 2019. And the goal is for those that have been importing to migrate to local manufacturing. And that has resonated well with Mr. President in terms of the directive that he gave last year, the executive order, to ensure that we are capacitated to manufacture locally.
The NAFDAC DG added that the policies and activities being executed by NAFDAC are part of the renewed National Action Plan. Earlier, in her own speech, Dr. Pamela Ajayi, the President, Healthcare Federation of Nigeria, spoke on the need to entrench universal health sovereignty in Nigeria.
Many of you may not know it, but I'm a strong advocate of universal health sovereignty. And I think it's very important that we make sure that we can produce all, if at all possible. It may not be possible to produce all, but at least 90% of what it is we use. We need as a nation to be able to produce it, to make sure we don't go back to those days of when there was a crisis, there was a pandemic, and the doors of the world were shut to us, and we were found left out in the cold, and we started running out of drugs, running out of equipment. We couldn't get ventilators, we couldn't get this, couldn't get that. That kind of thing should not happen to a nation again, and certainly not to a nation as large as Nigeria.
The representative of the Honorable Minister for Health and Social Welfare, Dr. Abdul Mukhtar, also spoke on the reason for the presidential initiative for the healthcare value chain.
It was established by His Excellency Mr. President in October 2023 with three very clear objectives, and two of them are actually sub-themes in this summit. So the first one is increasing the share of locally manufactured products in Nigeria. The second is reducing outbound medical tourism. $1 to $2 billion every year, people going mostly to Asia and other places. It's not tenable. So how do you do that? You build the right quality infrastructure for health, diagnostic facilities, and so on and so forth. And then the third one is really jobs, creating high quality jobs across the various parts of the value chain, while also mobilizing resources, both foreign and domestic.
And now, moving on to NAFDAC news updates. An attempt to assassinate the NAFDAC Southeast Zonal Director, Mr. Martins Eluyomade, has been foiled. The foiled assassination attempt was made at Bridgehead Market in Onitsha. The market is one of the open drug markets where NAFDAC has been carrying out massive raids in the last few weeks.
Just this morning, behind me here, up here, our gallant security people that were on ground discovered 2 guns that were planted here. You know, this is where we load the trucks. This is where we load the trucks. They were doing a search operation and they discovered 2 guns that were planted here by unknown people. Probably, we don't know what their aim was. We know it's an assassination attempt on this operation and on us. Because this is where I normally stand when I want to breathe and when I want to conduct what's going on. We saw guns planted for whatever reason they wanted to do, and with live cartridges.
NAFDAC has therefore reiterated the agency's commitment to continue to do all it takes to nab dealers of substandard, falsified and unregistered drugs and other regulated products, urging the Nigerian people to support the drive to ensure that the health of the nation is safeguarded. That was NAFDAC Update. You have been updated.
That's how far we can go on this episode of the program. If you have comments, complaints or observations, or you want to report any case of fake food products or drugs, we are always accessible.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Do not engage in activities that will put efforts of NAFDAC to safeguard the health of the nation in jeopardy. Do not import or produce fake food products and drug. Do not sell adulterated cosmetics. Do not sell unapproved medical devices. These acts endanger the lives of the public. Till we come your way again next week. Stay safe.